thank you very much for your kind invitation. Now, the title is Does centralization in selected hospitals offer better results for elbow replacement surgery? Now, to rephrase that, we'll talk about surgeon volume and hospital volume and how does that relate to patient outcomes when it comes to elbow replacement surgery. Now, the main idea, the fundamental idea is that patients who are treated in low-volume hospitals or by low-volume surgeons, people who don't get the chance to operate, to perform elbow replacements frequently, would end up with higher revision and complication rates when compared to higher volume hospitals or surgeons, respectively. The centralization of specialist services is nothing new in medicine, especially in surgery. There are many surgical specialties who use it for many years. It's a well-established practice. And we use it in orthopedics as well with the trauma networks. Now, in lower limb arthroplasty, there are numerous studies with very large pools of patients, more than 20,000 cases for the study about uni-knee replacements, that actually support this view. But when it comes to elbows, there are very limited data to back this view. And this derives from the amount of patients we have available from the joint registries. You can see that the ratio is 1 to 100 when we compare elbows to hips and knees. And if we add private cases on top of that, the distance grows even more. Similar numbers can be pulled from other notable joint registers as well. So we had the opportunity to perform a database search. Much to my disappointment, there were very limited data available, very few, only a handful of studies available to look up. These 5 studies actually were the only ones we could pull some data from. So we'll have a better look at each and every one of those. The first one comes from the New York State Registry. 373 surgeons have performed 1,100 total elbow replacement. What is striking here is that 90% of those surgeons have never registered a single case before in the registry, and only 5% have actually performed more than 20 cases. There was a trend for higher revision rate, but no difference was found in other complication rates. The authors comment that this is only due to the very small amount of surgeons that were actually performing numerous cases. Let's continue with the next study. Similar data can be pulled from this study. It comes from the Scottish Registry. 51 surgeons performing 1,146 total elbow replacement. There was no statistical difference in regards to infection, dislocation, or prosthetic fracture following elbow replacement, but implant survivorship was slightly better for more experienced surgeons. When it comes to hospital volume, this is a Finnish study that compared patients operated in specialist hospitals that were dealing with rheumatoid arthritis and non-specialized hospitals. And they concluded that there was a 50% increased chance of revision for low-volume hospitals compared to high-volume hospitals. Lastly, this is the most recent study and the only one that used somehow more sophisticated statistical methods to identify a cut-off point at what we mean low volume or high volume. So regarding complication rates, they found out that in hospitals where more than 21 cases were performed per year, there was almost a 5% frequency of complications compared to hospitals that were doing 4 to 20 or 1 to 3 procedures. The same is still true for revision rate and total cost of admission. The extended stay, which is comparable, is mostly attributed to the complexity of the cases that those hospitals were dealing with. Now, just to finish with, about 5 years ago, best surgeons have published guidelines regarding the provision of elbow replacement surgery. They suggested this hub-and-spoke model of referral with referring hospitals and regional centers. It's a quite detailed paper, very interesting to go through. these are the main points. So, not to bother you anymore, the conclusion. We believe that for low-volume surgical procedures such as elbow replacement, reducing the number of providers appears to be a reasonable option. This will enhance the competence level of surgeons and concentrate experience and expertise, leading to improved overall patient outcome. Thank you very much.